There's something called osteoarthritis. Can you use your fake neck and kind of tell us what it is, doctor? It's sometimes called degenerative disc disease.
Okay, that's basically, we have the...
Hold it. Like,
hold my neck.
There you go. Hold your neck.
All right, yep. So we have the disc over here.
Don't move it too much. Okay.
All right, so we have the disc. We have the bones. So degenerative disc disease is something that will happen as we age. The disc, they start desiccating, they start losing some water content. So what they do is that they start thinning down. When they start thinning down, that's what the principle that I was talking before. When they start thinning down, remember the disc bears 80% of the load of the spine. So then the rest, that load that is being diminished, instead of being now 80, let's say 60, so that extra 20% is going to be distributed to a pair of joints that we have here in the back, which are the facet joints. Okay, so we have one on the right and one on the left. So they can become arthritic, and that's what we call arthritis of the neck.
All right, and another neck problem can be caused by a herniated disc.
Herniated disc.
We hear that a lot. I actually think we have a picture of one. Let's see if we can take that real quick.
Oh, yeah.
And tell us what we're looking at there, doctor.
All right, so what you're looking there is the neck. If I slice someone in half and I'm looking them from up to down, I see, it will say you the front and the back, and then we have the nerves. So the jello, I mean the jelly that we have in between, that is blue, that's the center of the disc. So it's escaping through a rent or a fissure there, and is touching there the yellow structure, which is the nerve, and that can become painful. So typically what happens as we age, I was talking, the disc degenerates, they start losing some water content, so the disc becomes more weaker. So any position that you do that you increase the intradiscal pressure, even like coughing or sneezing or straining, that can cause the disc to slip out and touch that nerve. And that's when people, they have this stiff, sometimes all of a sudden a stiff neck, and they can have even symptoms going down the arm.
Is this when you perform a discogram?
A discogram is different. It's a procedure that we use for diagnostic purposes, and it's mainly when we have multiple levels that are degenerated, that we want to look which level is causing their pain, so a surgeon can either do a cervical disc replacement or a fusion. So it's just that we have multiple levels that they look dark, and we go ahead under X-ray guidance and we put a needle like that inside the disc, and we put a dye or contrast to highlight the disc and look at the morphology and see whether that disc is painful or not.